Introduction: the alarming truth about vitamins and leg health in seniors. We often think of vitamins as essential nutrients that are safe for our health. However, this isn't always the case, especially for older adults. As we age, our bodies process nutrients differently than when we were younger. Some vitamins that we regularly supplement with the belief that they will improve our overall health can actually have serious consequences for leg strength and mobility. Recent research has indicated that certain vitamins are silently weakening the leg strength of seniors, leading to increased risk of falls, limited mobility, and reduced quality of life. This becomes even more serious when many seniors don't recognize the connection between their vitamin use and the leg muscle weakness they're experiencing. While vitamins are necessary for overall health, when used incorrectly or inappropriately, they can become a threat to seniors' health. Scientists have identified at least 3 vitamins that, when used excessively or unnecessarily, can silently destroy the leg strength of older adults. This article will explore in depth how these specific vitamins can cause harm, provide the scientific explanation behind the issue, and offer safer alternatives for seniors who want to maintain their leg strength and mobility.
Vitamin D, friend or dangerous enemy of leg strength. Vitamin D is considered one of the most important vitamins for senior health. It plays an essential role in calcium absorption, maintaining bone health, and supporting immune function. Many older adults are advised by doctors to supplement with vitamin D due to the body's decreased ability to produce vitamin D naturally with age and limited sun exposure. However, high dose and prolonged use of vitamin D can lead to several serious health issues, particularly affecting leg strength. Research from Johns Hopkins University has found that higher doses of vitamin D are not always better for seniors and can actually increase the risk of falls. In a clinical study, researchers discovered that people using high doses of vitamin D, 4 as an IU or 10,000 IU daily, for extended periods, not only didn't improve muscle strength, but were also more likely to fall than those using lower doses, 1 IU daily. Vitamin D toxicity, hypervitaminosis D, occurs when blood levels of vitamin D are too high, usually due to excessive supplement consumption. This leads to a condition of elevated calcium in the blood, hypercalcemia, causing various symptoms including muscle weakness, difficulty walking, and bone pain. Seniors are particularly susceptible to these effects due to age-related decreased kidney function, which reduces the ability to eliminate excess calcium from the blood. In one case report, an elderly person experienced severe muscle weakness after taking high-dose vitamin D supplements for several months. They had difficulty standing up from a chair, climbing stairs, and even maintaining balance while walking. Tests showed abnormally high blood calcium levels and vitamin D levels many times above normal. After discontinuing supplementation and receiving medical treatment, their muscle strength gradually improved, but it took many months for full recovery. Why does vitamin D affect muscle strength in this way? When vitamin D levels are too high, it increases calcium absorption from the intestines into the bloodstream. High calcium in the blood can affect neuromuscular function, causing muscle weakness, especially in the legs, the muscles that bear the body's weight. Additionally, prolonged high calcium can lead to soft tissue calcification, causing pain and reducing mobility. However, it's important to note that appropriate levels of vitamin D are still essential for bone and muscle health in seniors. Vitamin D deficiency can also lead to muscle weakness and increased fall risk. The issue is finding the right balance and avoiding unnecessary oversupplementation. For seniors, instead of self-prescribing high doses of vitamin D, check blood vitamin D levels through medical testing. Only supplement as directed by a doctor and at appropriate dosages. Increase safe sun exposure, 10 to 15 minutes daily. Include natural food sources of vitamin D such as fatty fish, egg yolks, and mushrooms. Vitamin B6. Risk of peripheral neuropathy and leg muscle weakness. Vitamin B6, pyridoxine, is a water-soluble vitamin that plays important roles in many metabolic processes, including protein synthesis, nervous system function, and blood formation. It's found naturally in many foods and is also commonly included in multivitamin products. However, too much vitamin B6 can have serious consequences for leg strength and function, especially in older adults. Vitamin B6 toxicity is one of the rare but serious causes of peripheral neuropathy, a condition that causes tingling, numbness, or pain in hands and feet. This side effect is typically associated with high-dose, prolonged use of vitamin B6, but concerningly, it has also been reported in people taking lower doses, just 50 milliliters daily, over extended periods. According to a report from Australia's Therapeutic Goods Administration, TGA, from 2020 to present, they have received 119 reports of peripheral neuropathy due to vitamin B6 toxicity. Notably, many patients were unaware that their symptoms could be related to vitamin supplement use, leading to delayed diagnosis and prolonged nerve damage. One general practitioner shared a personal story about suffering from severe vitamin B6 toxicity, to the point of being unable to walk. They described, "I noticed a slight reduction of strength in upper leg muscles and in my glutes. Then there was a continuous slow deterioration of muscle. This condition progressed to the point where they had difficulty walking and performing daily activities." Concerningly, vitamin B6 can accumulate over time, and similarly, toxicity can take up to 6 months to resolve after discontinuation. The harmful mechanism of high-dose vitamin B6 on the nervous system and muscles is related to its impact on sensory nerve cells. High-dose vitamin B6 damages sensory nerves, disrupting normal sensation and leading to paresthesia, abnormal sensations like pins and needles or crawling in the hands and feet. As the condition progresses, it can affect motor nerves, causing weakness and muscle atrophy, especially in the legs. In seniors, this impact is even more severe due to the natural aging process, already reducing muscle mass and strength. A study published in the Journal of Neurology reported a case of sensorimotor neuropathy secondary to pyridoxine toxicity that can be debilitating but is potentially reversible with timely cessation of vitamin B6 supplementation and intensive physiotherapy. However, if nerve damage is severe enough, some effects may become permanent. Notably, both deficiency and excess of vitamin B6 can cause similar neurological symptoms, making diagnosis complicated. Many seniors increase their vitamin B6 dosage when they experience initial symptoms, inadvertently worsening their condition. For seniors, remember that the daily requirement of vitamin B6 for people over 51 is only 1.7 milligrams for men and 1.5 milligrams for women. Symptoms, like numbness, tingling, pain, or weakness in the legs, may be signs of vitamin B6 toxicity. Stop vitamin B6 supplementation. If any neurological symptoms appear, and consult a doctor. Prioritize vitamin B6 sources from food such as meat, fish, potatoes, and starchy vegetables rather than supplements.
Vitamin A. Beware of this powerful fat-soluble vitamin. Vitamin A is an essential fat-soluble vitamin that plays important roles in vision, immune function, and skin health. However, it's also one of the vitamins with the highest potential for toxicity when overdosed, especially for seniors. Unlike water-soluble vitamins that can be excreted through urine, fat-soluble vitamins like vitamin A are stored in fatty tissue and the liver, where they can accumulate to toxic levels if consumed in excess over time. Vitamin A toxicity can occur in two forms: acute, from taking a very high dose in a short time, or chronic, from taking higher than recommended doses over a long period. The chronic form is more common and particularly relevant to long-term supplement use in seniors. Signs of chronic vitamin A toxicity include muscle pain and weakness, especially in the legs. This occurs because excess vitamin A can impact the structure and function of muscle cells, leading to muscle degeneration and weakness. Seniors are particularly susceptible to this effect as they are already experiencing age-related natural decline in muscle mass and strength, sarcopenia. A study published in Toxicology Reports documented a case of an elderly woman who developed severe muscle pain and weakness after taking high-dose vitamin A supplements for several years. Blood tests showed abnormally high levels of retinol, the form of vitamin A in blood. The patient had significant difficulty climbing stairs, getting up from chairs, and maintaining balance while walking. After discontinuing vitamin A supplementation and receiving medical treatment, her symptoms gradually improved, but it took many months to significantly regain muscle strength. Diagnosing vitamin A toxicity is often overlooked in seniors because symptoms can be attributed to natural aging or other health conditions. This is especially true when it comes to declining leg strength, which is often considered a normal part of aging. However, rapid or significant decline in leg strength should not be ignored, and the potential role of excessive vitamin A supplementation should be considered. Besides the impact on muscles, high-dose vitamin A can also cause several other health problems, including liver damage, decreased bone mineral density, increasing fracture risk, headaches, and vision changes. These issues, when combined with muscle weakness, can exacerbate mobility decline and increase fall risk in seniors. An important point to note is that most Americans, including seniors, get enough vitamin A from normal diet without supplementation. Foods rich in vitamin A include liver, carrots, sweet potatoes, spinach, and other dark green leafy vegetables. Additionally, many foods like breakfast cereals, milk, and milk substitutes are fortified with vitamin A. For seniors, remember that the upper tolerable intake level, UL, for vitamin A is 3,000 mcg RAE, 10,000 IU, daily for adults. Avoid vitamin A supplements unless specifically prescribed by a healthcare professional. Be cautious about using multiple supplements containing vitamin A, including multivitamins. Consider food sources of vitamin A rather than supplements. Monitor any changes in leg strength and discuss with healthcare professionals.
The dangerous combination: when multiple vitamins destroy your leg strength. The potential danger of vitamin supplementation is not limited to excessive use of a single vitamin. Many seniors often take multiple supplements simultaneously, creating the risk of interactions between different vitamins and minerals, which can exacerbate the negative impact on muscle strength and leg function. One of the most concerning combinations is the simultaneous use of vitamins A, D, and E, all fat-soluble vitamins that can accumulate in the body over time. Each of these vitamins, when used excessively, can cause negative impacts on muscles and the nervous system, as discussed previously. When combined, they can create a perfect storm that weakens leg strength and significantly increases the risk of falls and loss of mobility. For example, while high-dose vitamin D causes hypercalcemia leading to muscle weakness, excess vitamin A can exacerbate this problem by competing with vitamin D and interfering with calcium metabolism. Similarly, high-dose vitamin E can affect blood clotting, increasing bleeding risk, especially when combined with some common medications in seniors such as anticoagulants. One study found evidence that supplementation with vitamins C and E may blunt increases in total lean body mass in elderly men after strength training. This suggests that even vitamins considered beneficial for overall health may interfere with the body's natural adaptation to exercise and reduce the benefits of physical activity for muscle strength in seniors. Additionally, many seniors also take prescription and over-the-counter medications, creating the potential for complex interactions between drugs and vitamins. For instance, some medications may increase the risk of vitamin toxicity by affecting how the body metabolizes and eliminates vitamins. Conversely, some high-dose vitamins may affect drug efficacy or increase their side effects. Another factor to consider is the phenomenon that more is not always better when it comes to vitamin supplementation. Many people don't realize that the human body has complex self-regulating mechanisms to maintain vitamin and mineral balance. When we interfere with these mechanisms through excessive supplementation, we may inadvertently cause imbalances leading to various health problems, including muscle weakness. For seniors, a comprehensive and cautious approach to vitamin supplementation is necessary. Discuss with healthcare professionals about all supplements you are taking. Consider periodic testing to monitor blood vitamin levels. Avoid self-prescribed combinations of multiple fat-soluble vitamins A, D, E, K. choose multivitamins specifically designed for seniors with appropriate dosages, rather than using multiple individual supplements. Maintain an updated list of all medications and supplements you are taking and share with all healthcare providers. Sarcopenia and vitamin supplementation. Understanding age-related muscle decline correctly. Sarcopenia, the age-related loss of muscle mass and strength, is a common issue in seniors and a major cause of leg function decline and reduced mobility. Many seniors turn to vitamin supplements, hoping to prevent or reverse this condition, but is this the right approach? Sarcopenia affects approximately 10% of people over 60, and this percentage increases significantly with age. It involves a decline not only in muscle mass, but also in muscle strength and function. Scientists believe that multiple factors contribute to the development of sarcopenia, including hormonal changes, chronic inflammation, decreased protein synthesis, oxidative stress, and lack of physical activity. Some vitamin and mineral deficiencies, particularly vitamin D, calcium, and magnesium, can indeed contribute to sarcopenia, and in these cases, supplementation may be beneficial. However, a common mistake many seniors make is assuming that if a small amount of vitamins is good, then more will be better. This logic has led to excessive use of supplements, which can be counterproductive and actually exacerbate muscle weakness rather than improve it. For example, one study found that vitamin D supplementation does not improve muscle strength, power, or physical performance in older adults unless they are severely vitamin D deficient. In fact, participants taking high doses, 4,000 IU daily, showed no benefits compared to those taking moderate doses, and some even experienced negative impacts on muscle function. So what is the right approach to maintaining leg strength and preventing sarcopenia in seniors? A comprehensive approach includes regular strength training. This is the most effective intervention for maintaining and building muscle mass and strength in seniors. Even people in their 80s and 90s can achieve significant improvements in muscle strength through appropriate exercise. Adequate protein intake. Seniors need more protein than younger adults to maintain muscle mass. Aim for 1.0–1.2 grams of protein per kilogram of body weight daily, spread throughout the day. Balanced nutrition. Focus on a diet rich in fruits, vegetables, lean proteins, and whole grains to provide the full spectrum of nutrients needed for muscle health. Targeted supplementation only when necessary. Use supplements only to address specific deficiencies confirmed by medical testing, not as a preventative measure without evidence of need. Regular medical checkups. Periodic assessment of vitamin levels, muscle strength, and overall health can help identify problems early and guide appropriate interventions. Medication review. Some medications can contribute to muscle weakness. Regular review of all medications with healthcare providers can help identify and address these issues.
The role of physical activity, more important than any vitamin. While much attention is given to nutritional supplements for maintaining leg strength in seniors, research consistently shows that physical activity, particularly strength training, is far more effective than any vitamin supplement for preventing and treating sarcopenia and maintaining leg strength and function. Multiple studies have demonstrated that even very elderly and frail individuals can improve muscle strength and function through appropriate exercise programs. A systematic review of 121 trials involving over 6,700 participants found that progressive resistance training in older adults led to significant improvements in physical function, gait speed, balance, and most importantly, leg strength. In fact, when comparing the impact of exercise versus vitamin supplementation on leg strength in seniors, the evidence overwhelmingly favors exercise. While vitamin D supplementation in deficient individuals may provide a modest 5–10% improvement in muscle strength, appropriate strength training can increase muscle strength by 25 to 100%, even in people over 90 years old. What types of physical activity are most beneficial for maintaining leg strength in seniors? Progressive resistance training, using weights, resistance bands, or body weight exercises that gradually increase in difficulty as strength improves. Balance exercises, Activities like Tai Chi, yoga, or simple standing balance exercises help improve stability and prevent falls. Functional exercises, movements that mimic daily activities, such as sit-to-stand exercises, stair climbing, and walking. Regular walking, even modest walking programs can help maintain leg function and overall mobility. For seniors concerned about declining leg strength, investing time in these physical activities will yield far greater benefits than any vitamin supplement regimen. Importantly, exercise has multiple additional benefits beyond muscle strength, including improved cardiovascular health, better blood sugar control, enhanced mood, and reduced risk of many chronic diseases. Practical steps. What seniors should do about vitamins and leg strength. Given the complex relationship between vitamins and leg strength in seniors, what practical steps should older adults take to maintain their leg strength while ensuring proper nutrition? Here's a comprehensive approach.
Get a professional assessment. Consult with healthcare providers about appropriate vitamin supplementation based on your individual health needs. Consider getting blood tests to identify specific deficiencies before starting any supplements. Discuss any concerns about leg weakness or mobility issues. Review current supplements. Make a list of all vitamins and supplements you're currently taking. Check the dosages against recommended amounts for seniors. Be particularly cautious about fat-soluble vitamins, A, D, E, K. Consider whether you need each supplement or if you could get these nutrients from food. Watch for warning signs of vitamin toxicity, unexplained muscle weakness, especially in the legs, difficulty climbing stairs or rising from chairs, numbness, tingling, or pain in extremities, balance problems, or increased tendency to fall. If you experience these symptoms, discuss your supplement use with healthcare providers. Focus on nutrition first. Prioritize a balanced diet rich in fruits, vegetables, lean proteins, and whole grains. Include natural food sources of important vitamins, rather than relying on supplements. Stay well hydrated, as dehydration can exacerbate muscle weakness. Embrace physical activity. Engage in regular strength training exercises, even if very gentle. Practice balance exercises to improve stability. Maintain regular walking or other aerobic activities. Consider working with a physical therapist to develop an appropriate exercise program. Consider a senior-specific multivitamin. If supplementation is needed, a balanced multivitamin formulated specifically for seniors may be safer than multiple individual supplements. Look for products with appropriate, not excessive amounts of fat-soluble vitamins. Regular monitoring. Schedule regular checkups to monitor vitamin levels and muscle function. Adjust supplement use based on test results and health status. Be proactive about addressing any decline in leg strength or mobility. Conclusion: balance and informed choices for healthy aging. The relationship between vitamins and leg strength in seniors is complex and often misunderstood. While adequate nutrition, including appropriate vitamin intake, is essential for maintaining muscle health and function, excessive supplementation can be counterproductive and even harmful. The three vitamins of particular concern are vitamin D, vitamin B6, and vitamin A, which when taken in excess can silently destroy leg strength in older adults. The key message is not that seniors should avoid vitamins entirely, but rather that they should approach supplementation with caution and knowledge. The more is better philosophy can be particularly dangerous when it comes to fat-soluble vitamins and certain water-soluble vitamins like B6, which can accumulate to toxic levels. Instead of relying heavily on supplements, seniors should focus on a balanced diet, regular physical activity, and targeted supplementation only when necessary based on professional medical advice. This comprehensive approach to maintaining leg strength will not only help prevent sarcopenia and mobility limitations, but also contribute to overall health and quality of life in the later years. Remember that maintaining independence and mobility as we age depends far more on our daily habits, particularly physical activity and balanced nutrition, than on any pill or supplement. By making informed choices about vitamin use and prioritizing proven strategies for maintaining leg strength, seniors can enjoy active, independent lives well into their golden years. The greatest strength doesn't come from a bottle of vitamins, but from the wisdom to use nutrition wisely, stay physically active, and work collaboratively with healthcare providers to address individual health needs. This balanced approach is the true key to preserving leg strength and mobility throughout the aging process.